Good evening all. Today we'll discuss the history of energy uses in surgery and the principle of electrosurgery and the energy devices that is used in laparoscopic surgery and the electrosurgical complication. In the history of electrosurgery, you can see the 469-370 BC. Hippocrates advocated the therapeutic use of cautery in the first time. Then 1926, the Bobby and Cossing used the electrosurgical generator to excise a vascular myeloma, introduced the technique of cutting, desiccation and coagulation that will establish the modern electrosurgical principle. Then in 1980, the bipolar electrosurgery became the popular and delicate per coagulation procedures, and in 1990, the advanced energy device like Ligas or harmonic scalpel and revolutionize the basal sealing device. Okay. Next is the principle of electrosurgery and the applied physics. Basically, the definition of electrosurgery is the application of high frequency alternative current. What is the difference? The difference here is in our household we are using a like low frequency like 60 kilohertz, 60 hertz. Okay, you are using in the household, it is called 60 hertz, so that will not cause any damage to your body. But here you have to use a high frequency AC current that produce thermal tissue effect, and that will lead to cutting, desiccations and coagulations. And the electrocautery, what is the difference from electrocautery? It is a battery system. Battery, you can see the use of this, it use only direct current, not alternative current. So electrocautery and electrosurgery is different. By electrosurgery is a high frequency alternative current, and electrocautery is a direct current. That is, here the current is not passed through the tissue, it will hit the electrodes and then it is passed. So basically, the high frequency alternate current that is more than 500 kilohertz avoid electrolysis and paradigm effect, called as radio frequency electrosurgery. So what is the components of electrosurgical circuit component? Is it is a, there will be a generator, electrosurgical unit generator, and two electrodes. One is your active electrode. Here you can see this is the monopolar setup. Here is the active electrode going into the patient body, and the return electrode is, that is the dispersive electrode, that is padded in the back of the patient's body. Dispersive electrodes that is returned back to the electrosurgical unit, and the patient act as a conductors. Okay. So here is the direct current. Electrocautery use the direct current. Here what is the continuous, is the same voltage current will be there. There is no oscillation. What happened in the difference in the electrosurgery alternate current you are using, here there will be voltages up and down, and the oscillation wave will coming out, that will cause cell will oscillate, and diffusion of sodium and potassium ion into the cells. Sodium and potassium, that will cause increase the frequency, that will cause changes in the tissue effect. Okay, so current types is direct current is the unidirectional, there will no, and use call electrocautery. Alternate current is bidirectional, it is electrosurgery. Okay. Next, you can see the electrosurgery unit. There will be a bipolar device and one is a monopolar. In the bipolar, the patient the electrode is everything is in the same electrodes. Here the electrode placement, the active and the bipolar, both electrode at the instrument tip, and electrode in the monopolar, the active electrode will be there and the dispositive in the body of the patients. So there will be a need of return pad in the monopolar, and there will be no need of return pad in the bipolar, because the both the electrodes in the tip of the instrument in the bipolar and the patients, and the electric current is coming, and it is returned back through the next adjacent electrode. But in monopolar there will be single electrodes, and it's connected to the patient body. The current is passing through the patient body, and in the through the dispersive electrode it is go out to the electrosurgical unit. So common use of monopolar is cutting and coagulations and fulgurations, and in bipolar it will cause precise coagulations and basal sealing. Then the function of the electrosurgical unit, what will do? Our household is only low frequency, that is in our household current is low frequency current, that is 50 to 60 hertz. So from the output, from the box, from the connector, from the current box, from the in our OT there will be a current box, no, current supply. From the current supply, it will be the current from the current supply, it is 50 kilohertz. But how it will convert to high frequency 5 kilohertz to 3 megahertz? By this electrosurgical unit. This is the electrosurgical unit. The mechanism of the function of the electrosurgical unit is convert the low main frequency, that is main frequency is your output from the electro supply, 50 to 60 to high frequency 500 kilohertz to 3 megahertz. And it will also adjust voltage and the voltage of the current and control the duty cycle, that is the ratio of on to off times. The electrosurgery use the radio frequency current, that is the 500 kilohertz to 3 megahertz. The current cause, what is the mechanism of actions? Now the current will cause intracellular conversion of the electromagnetic energy is now converted to mechanical energy, and this mechanical energy is converted to thermal energy. How? Now the basically the this is the electromagnetic frequency, that the electromagnetic energy is converted to the mechanical energy, and this mechanical energy is converted to thermal energy. Now the thermal energy called tissue heating effect. The tissue heating effect is resulting, either it will cause cutting, either it will cause coagulation or desiccation or fulguration. That will be based on your temperatures, how much thermal effect. So if the temperature thermal energy is more than 100 degrees centigrade, that will cause cutting. If it is 60 to 95 degrees centigrade, that will cause coagulation and desiccations. If it is more than 200, that will cause that will be superficial and non-contact, that is cause fulgurations. So normally in our body, if it is 37 degree, it is normal body temperature. It is 40, it is cause no structural damage. 50 degree, the cell death within 6 minutes, and 60 degree, that instant cell death will start at 60 to 95, instant cell death plus desiccations and coagulation will come. White coagulation, it is called as white coagulations. Then 100 degree, that is cell will be cellular vaporization and cutting start, expulsion of the cells. 200 degree is called carbonization or black coagulation. So these are the basic things you have to remember. The factor affecting the tissue effect. Basically, the electrosurgical tissue effect depend on the thermal energy productions controlled by the modified surgical device related factors. So when the waveforms, basically it depends, the cutting will depend on the waveform. If it is a continuous continuous and low voltage current, that will cause rapid heating. Continuous voltage and low current, continuous low voltage current, it will cause rapid heating, and it will not allow the cell to cool. That is the cooling effect of cell here is lost. So what happened, the cell will suddenly burst. Bursting of the cell is called vaporizations. The vaporization will call sudden burst of the cell, that will causes cutting effect in the tissue. Next is your coagulation mode. In the coagulation mode, it is high voltage but interrupted. Here is continuous low voltage current, is continuous low voltage, that will cause cut mode. Interrupted high voltage, because here there will be a cooling effect of the cells. That slow heating will call denaturation of protein, that will cause coagulations. So very important. And the blend mode is in between, variable, the mix of cutting and coagulation. So very important, the three, the low current, low voltage, a continuous low voltage current is called rapid heating, because there will be less chance to cell get cooling. So sudden vaporizations, bursting of the cells will occur. And interrupted high voltage current, that will cause slow heating, but that will cause coagulation. Blend is more in between. This is the waveforms I told. So continuous low voltage cutting, white coagulation, and effect is clean cut on continuous low voltage cut, and blend cut. Interrupted high voltage is called white coagulations. So factor affecting the tissue effect, one is your power output measured in watts. High power fast order effect but increased risk of burn. Recommended setting is cutting is 50 to 80 watts. Coagulation setting should be 30 to 50 watts. Remember. So use lowest effective setting have to use, because there will be more chance of injury to burn. Adjust the based on patient tissue type. If the patient is muscular, then low power setting you have to use. If the patient is fatty and scar tissue is more, so higher power setting you have to use. So basically you have to remember the power setting output for cutting mode 50 to 80 output, and the coagulation is hard to 30 to 50 watt. The electrode surface area, smaller electrode tip, the higher current density. Reducing tip diameter by half, it will increase the thermal effect. Achieve effect without increase the porosity. Then the activation time and the tissue impedance. The longer activation, more you will heat and greater lateral spread. Very, very important in our surgical cases, because you have to prevent the lateral spread, because it's very, very important. You are doing the surgery in your vital structure. So very short activation, incomplete effect. So you have to a short intermittent burst for safety and precision. So activation time, you don't give longer activation or don't give very short activation. If you give longer activation, there will be more heat and lateral spread. If you give it a short activation, there will be incomplete effect. Use short intermittent burst for safety precision. Tissue impedance, if it is high impedance, there will be greater thermal effect. Clean electrode and dry field enhance effect. So tissue type, it is a fat and scar tissue, there will be a higher impedance effect, will be increased heat generation. Muscle weight tissue, low impedance, decreased heat effect. So what to do, how to balance this enhance effect without increase your power? So we have to reduce the tip of the electrode radius, having half the radius, increase the 16 times thermal effect, and increase tissue impedance. How will increase the tissue impedance? Suppose you have to remove the blood, remove the fluid, compress the vessels, stretch the tissue, avoid increasing weightage unnecessarily, prevent unintended burn. Okay.